So another thing, by the way, is if the patient is taking up blood thinners, if you notice it from the patient's chart, we have to put pressure more than 2 minutes to make sure that the patient will no longer bleed after you take the blood gas. So by the way, so after pushing this through in the red cup, we have to remove the red cup itself together with the needle, and then we have to dispose it directly to a proper waste disposal. If there are sharp containers present, we have to throw it directly. And after this, we have to ensure that we have put it in the proper cap, cover it, and then make the necessary documentation. And then once the pressure is already okay based on your assessment, we have to put a band-aid on it, cover it, and then once you're ready, put this one in the proper waste bag, as you notice, and then we have to send it immediately after we take up the blood gas. Or if you take a little bit much time, we have to put it on a little bit on ice to prevent any clotting. And then this you can see the sticker, we have to put it here with the necessary information by putting the temperature, the test, and also with the ventilation, because the patient is is having a nasal cannula, so they have been on O2 at 2 liters. So by checking the approximate FiO2, we have to compute it with times 4 plus 20, which would take up equivalent of 28% FiO2. Then we will put it on what device they're putting up. So after we've done taking up the EBG, we have to ensure the patient is comfortable, reassess them, observe them based on your assessment, and put it in your proper documentation. And also you can even give them some little bit assistance if whatever they need for your part. And then some other hospitals, by the way, especially in large facilities, they usually send it with a pneumatic tube on top, where it will immediately send it directly to the lab in just a few minutes. So after that I'm done, I have to remove gloves, wash my hands, and I think that's it.